Well, so today I'm going to talk about in continuation with the earlier lecture, antimicrobial resistance in hospital. We have talked about the hospital nosocomial infection in earlier lecture, and we talk about the healthcare induced or healthcare system mediated infection, that is a nosocomial infection. So among them, the antimicrobial resistance is one of the most common and most important issue, or rather global issue in the hospitals, from where the such kind of infections spread, where the antibiotic resistance found in many of the bacteria which are causing the resistance. So generally, the hospitals provide a strong selective pressure for antimicrobial resistance because antibiotics are used heavily. So in the hospital environment, we found that because of the overpressure of the antibiotic use, the resistance developed in the bugs or in the bacteria. And if these bacteria, if somebody acquired the infection in the hospital as a secondary infection, then the infection may be very deadly or severe, because such infections are difficult to treat because of the resistance against several antibiotics. Gram-negative bacteria such as Pseudomonas, Klebsiella, E. coli are often resistant from very many antibiotics, and they carry R factor, we call resistant plasmid. These resistant plasmids are the plasmids which carry the gene responsible for the resistance against each group of antibiotics or each class of antibiotics. Sometimes they may have a multiple antibiotic resistance. Recombination of R factors produce a multiple drug resistant strains. So if the number of genes are combined on the R factors or on the plasmid under different categories, they may sometimes the genes may also be recombined in the genomic DNA to become part of the bacterial genome, like in Pseudomonas, and many antibiotic resistant genes are present within the genome. Resistant bacteria can become part of the patient or staff microbiota, spread in the hospital, forming a reservoir for the resistant strains. So if such kind of resistant bacteria are present in the hospital, then there are chances of developing a reservoir for such kind of a bacteria in the hospitals, and that reservoir can be used as to propagate or to spread the infection later on, as we call the drug resistant infection, the bacteria which are having the drug resistance against the antibiotics causing the infection. In compromised patients, the patients which are on treatment, cancer treatment, or AIDS patients, or some low immunity patients, these patients are more prone to such kind of resistance, and resistance strains can cause difficult to treat in such patients because of the immunocompromised mode. The compromised host, by definition, we call them as a patient who defenses are weakened by diseases, therapy, trauma, burn, or some chemotherapy. There are two major factors of this: broken physical barriers like skin, mucus, membrane, burns, surgical wounds, injection, trauma. So all these factors are responsible for having infection, of such kind of infection. Invasive devices like indwelling devices like catheter, ventilators, IV lines, they provide entry surfaces for the microbial growth. So the microbial growth may possibly get entered through these routes in the hospital setting, or and so we call the nosocomial infection. The suppressed immune system means like a diseased conditions like AIDS, diabetes, or some comorbidities, what we call leukemia, kidney diseases and others. And such kind of conditions may pose the highly drug resistant strains in kind of infection. What are the therapies in order to combat with such kind of infection? So like radiation, chemotherapy, steroid, and immunosuppressant, and other factors like stress and malnutrition. So these are the factors which are responsible for such kind of a bacteria causing infection in the human system. Defense role: T cell which kill the pathogens, activate phagocytosis, secrete antimicrobial chemical. Right. So this is how the T cells can defend. So the most important thing is that to induce the immune system, to strengthen the immune system through various means, through immunomodulators, or even vaccines could have, therapeutic vaccines could have improved the immune systems and can defend such kind of infection. B cell, they produce antibodies and neutralize the toxins, block pathogens attachment, lyse microbes. So these functions is carried by the B cells. So the T and B cells are basically if active, then defense system is active and they can surpass such kind of infection. The suppression of T and B cell functions like HIV destroy the T cells, severe susceptibility against all various bacteria. Now, chain of transmission in a hospital, how the transmission of these kind of infection taking place in the hospital, that we can understand. The direct contact is staff, patient, patient to patient, staff to patients. Example is staff changing dressing. So when the staff changing dressing and the dress may have some kind of a contamination and they may come across with the patients and then patients may have got infection. Now, in direct contact, like fomites and equipment are responsible for the infection, especially in the hospital setting, the catheter, IV lines, and surgical dressing, respirators, contaminated foods, and etc. The airborne transmission, hospital ventilation system, humidifiers, respirators, these are all airborne transmission. The special high-risk hospital unit, burn wards, ICU, oncology, dialysis, patient grouped together, and high outbreak risks are the responsibility are responsible for the transmission of such kind of infection in the hospitals. So I have to break the chain if you want to block the transmission of such kind of infection. Now the control of HAI, that is, as earlier we talked about the healthcare. Activated system infection like healthcare associated infection, where the healthcare system is responsible for the infection spread. So universal precautions should be taken like CDC guidelines, Center for Disease Control and Prevention is an organization in the United States. They provide guidelines to protect the patients, staff, and visitors. There are two levels. One is standard precautions like apply to all patients regardless of a status. Hand hygiene are basically most important, yet compliance is like a 40%. If it could be 100% or even 90%, then the majority of the infections can be controlled. And PPE, the gloves, gown, face masks should be taken into account, like while working with the patients and in such environment. Respiratory hygiene is very important, like a cough etiquettes. How do you cough? How do you sneeze? These are all important things that to be considered. Safe injection practices. So you have to be disposable injections, hygienic and clean practices should be involved. The proper sterilization and disinfection of equipment is important. Autoclaving, properly sterilizing, heat sterilization, steam sterilizations. So these are the things which help you to control such kind of infection spread. Now the safe lumbar punctures and procedures, safe resuscitation and resuscitation is basically sometime may cause infection, so need to be very precaution should be taken in that. Similarly, lumbar puncture for some aspirations or something like that. Again, we have wherever we have some kind of invasive mechanism to be taken with patient, then there should be precaution should be taken. Transmission based precautions, right? How the transmission based precaution be taken for higher transmission pathogens like contact precautions, C. difficile, Salmonella, Shigella, droplet precautions, and then influenza, pneumonia, meningitis, pertussis, airborne precautions like TB, measles, chickenpox. So the most important thing here is that if you want to control the HAI, that is healthcare associated infection, then hospital setting should be clean and hygiene, and all hospitals should be regularly monitored for the infection control. And there's a need to establish an infection control monitoring of infection control. Staff should be very well trained, and staff should know how to handle the patients and what are the precautions to be taken by handling the patients, by touching the patients, or by providing the food during the hospital to the patients. So should be taking proper precaution like gloves, gown, face masks, and should be even the gloves should be properly washed and properly changes regularly as the patients change. And you should know all etiquettes of how you sneeze and how you cough during the site of patients or in the hospitals. So all these things should be released by the CDC, that is Center for Disease Control and Prevention guidelines. And transmission-based precautions for highly transmissible pathogens are contacts, droplets. Droplets are very important. Sometimes you may not aware about the droplets, and droplets may come to you and may cause infection. Now, in that case, the mask should be the best way to control the droplets. Now, additional control measures are disinfect bathing tubes, then you have respirators, humidifiers, should be very clean and should be, whenever it's used for patient to other patients, should be clean, sanitized, and properly disinfectant used to clean it. Use single use disposable items, for example, syringes, bandages, catheters, intubator, IV set. So all these things should be single use and disposable. Remove packaging aseptically to maintain the sterility. So you have to remove the packaging aseptically in the presence of very clean and hygienic conditions and without bacteria to maintain the sterility. Reduce the unnecessary antibiotic prescriptions and invasive procedures. So if you control the antibiotic use or overuse, or we call as unnecessary doses of antibiotics, then they can reduce the pressure of antibiotics in the hospital setting. And so after reduction of the pressure, the antibiotic resistance can be controlled. It can lose the genes from the plasmids, and bacteria can survive without having gene. Hospital must have an infection control committees to maintain, to monitor, to regularly check the infection if it is there, often with an epidemiologist and infection control nurses. And nurse and office staff should be well trained in order to monitor the infection, to realize about the infection and to control the infection as well. The monitors resistant strains like sterilization, quality, and contamination sources like tubing, catheters, and respirators. So you have to be very careful about the monitor resistant strain and sterilization quality. How you must ensure the sterilization, whether the properly sterilizations has been done or not. Sometimes you sterilize through steam, and because of some defect in the equipment, which is going to sterilize the equipment, or some needles, razors, and some other things, surgical items, then there's a problem of the infection. And so that has to be ensured that properly sterilization has been done, that can control the contamination, and all the contamination sources like tubing, catheter, respirator should be well taken. The pathogenicity and virulence. Pathogenicity is the ability of microorganisms to cause disease. Virulence is a degree of damage caused by the microorganisms to the host. So these are the factors which are responsible. So I call it like pathogenicity. High pathogenicity means high virulence factors or high expression of virulence factors. So degree of damage caused by the microorganisms to the host. And pathogenicity is a qualitative property, whereas the virulence is a quantitative property. In virulence, you can say, okay, this part is damaged and how much damage. But pathogenicity is how pathogen the bacteria is, how pathogen the parasite is. Now, virulence factors like adherence. So, virulence factors are defined as the factors which promote or which provide the support, which facilitate the process of virulent pathogenicity, the process of infection causing properties in the pathogen or in the parasite or bacteria or viruses. So adherence is one, because adherence by the Koch postulate is the primary and first thing that to initiate the infection. So it first adhere. So if you block the adherence process, the penetration will not take place. And when penetration is not takes place, invasion of the bacteria or viruses will not take place, then I think you are safe for infection. Then Invasion enzymes like collagenases and then leukocidins and hemolysin, these are the enzymes which are produced by the bacteria to defend and to make their more pathogen against the host, right? Because they help to dissolve collagen, and they can easily enter. They help to dissolve various cells to enter, like hemolysin, leukocidin, leukocytes, and hemolysin, and then uh, RBCs. Then we have it lies the blood cells, hemolysin, and then toxins like exotoxin type 1, 3, endotoxins like LPS, lipid A, evasions of a host immunity like a capsule, quorum. So they can evade out, they can easily escape from the immunity, from the host defense system, like phagocytosis. It cannot be phagocytosed because it can have a capsules, quorum sensing mechanism to promote the pathogenicity or virulence factors and antigenic variation. So they can change and vary the antigenic properties. Genes often located in the pathogenicity islands transferred by horizontal gene transfer. So these are all things which basically make the bacteria more pathogen and more virulence, and that causing the high infection. The microbial adherence is basically means like a first step of the infection as the cause postulate, where the bacteria get entered into the host system. So before it get entered, it need to be adhered. So there are certain things which help to enter in. For example, structure of involved like a capsule, slim layers. So adhesion plus anti-phagocytotic. So it will not phagocytose. So when the phagocytosis activated in the bacteria in the host system, then it engulfs the bacteria and kill the bacteria. Whereas in case of like these capsules and slim layers, they're not basically causing this phagocytosis. They basically act as an anti-phagocytosed state. Fimbriae and pili is another virulence factors present in the bacteria. For example, a specific binding to the host cells. It can also help to sometimes increase the motility and motile functions of these bacteria in many cases, which can help to reach to the site of infection. Flagella motility and addition, because they can also help in the motility of like swimming and motility of the bacteria, as well as the addition or attachment on the surface. So if the bottom line is that if we reduce these capsules, fimbriae, pili, and flagella uh, in through some intervention or through some gene suppression mean like CRISPR-Cas, then the cell's pathogenicity is reduced, our virulence factors are reduced. What is the outcome of this microbial adherence? It colonizes, form biofilms and nutrition access, nutrient access. Now, type of microbial penetration. If you look into the type of microbial penetration, like active penetration. So in active penetration, the mechanism of active penetration is a pathogen actively breaks host barriers using the enzyme toxin. What are the barriers? Barriers are in the cellular system. There are a lot of barriers like brain barriers, blood-brain barriers, and many other cellular barriers, cell wall, membrane, plasma membrane. So all these barriers, peptidoglycans in case of bacteria. So all these membranes are basically barriers. All the hindrance these are all barriers. So and also barriers like pore size is also barriers. Sometimes some of the pathogens may not get entered into through certain pore size, so it block. So active penetration means like a pathogens actively break the barriers through certain means, through certain enzymes, toxins. So they produce from the bacteria itself, and so we call such bacteria are called virulent bacteria. And these factors that is enzymes and toxins are called virulence factors. For example, collagenase degrade the connective tissue between the cell, and they can easily penetrate within the cell in intercellular infection. Then hyaluronidase is the enzyme produced by the bacteria. They break the hyaluronic acid. Hyaluronic acid is a cementing material on across the cell. For example, if you look at this, so for example, this is the cell. So this is how these cementing materials are present to protect the intracellular infection. So the bacteria, for example, these are the bacteria which cannot enter it through to enter into the cell. Therefore, what it does, it basically, this cementing material is reduced, or it completely gone. Then the bacteria can easily enter in a cell. So this is the mechanism of penetration. So the hyaluronidase is remove, is dissolve the cementing materials and allow the cells to get entered. So this is how it's kind sort of a what you call virulent factors and leading to pathogenicity, more prone for infection. Leukocidin kill the WBCs, hemolysin kill the RBCs, as just told earlier, and release iron. And the importance of these active penetration is it enables the deeper tissue invasion and spread of the infection. Similarly, passive penetration. Passive penetration is something where the involvement of some external enzymes are not required, but I think they can have some mechanical injury, some burn, some wounds, some damage. So pathogen can pass through these wounds through mechanical breakage or injury or tissue where the tissues are broken. So already existing tissues, broken tissues are used as a passive penetration of the bacteria. For example, there's some wound. So bacteria can easily get enter into the wounds. This is called the passive penetration. For example, cut, burns, insects, bites, surgical wounds, and so on. And it exploits the host injury to gain access. So this is the importance of the passive penetration. Now, intracellular invasion is something which is called the pathogen induces host and cell to engulf it in the heights inside the cell. So intracellular invasion, like in Salmonella, Listeria, Shigella, so these are all bacteria which induce the phagocytosis. So phagocytosis helps to invade and induce the host cells to engulf it in hide inside the cell. So this is called intracellular invasion, and this provides the protection from the host immunity and antibiotics. Now, this is very tricky because one time the phagocytosis is involved in killing the bacteria, and then after phagocytosis, sometimes lysosomes, they produce the enzymes, lysozymes, and they kill, they dissolve, they lyse the bacteria. Sometimes these phagocytosis help the bacteria not to be attacked by several enemies like antibiotics and several other enzymes. So both the way it works. So intracellular invasion means like it protect the bacteria, it protect the pathogens, and provide it protection from outside, so it may not be harmed. So outside defense system or immunity of the host will not harm this kind of a bacteria if they are intracellular invasion takes place through phagocytosis. Vector mediated penetration. Now, vector mediated penetration is like arthropods vectors. Then we have inject pathogens directly into the bloodstream and tissue, for example, mosquito. So, malaria caused by Plasmodium, dengue viruses caused by dengue caused by dengue viruses, then tick by Borrelia by tick. So all these kind of vector-borne diseases are responsible for the vector-borne disease. The vectors are responsible, right? For example, mosquito is responsible. So mosquito carries the Plasmodium vivax intermediate cycle, different stages of Plasmodium vivax in the mosquito blood. They inject it into the human blood, and then they can take some, and they can also transmit some other places. So basically, mosquito is one. Dengue fever is again caused by viruses. So this is such kind of infection called the vector-borne disease, and this is basically the importance of the vector-mediated penetration is bypassing the epithelial barrier completely. For example, this is how the virus or the Plasmodium vivax cannot enter inside it. But what the mosquito do, they have a needle-like structure at the mouth, and they can pierce the needle inside the skin, upper epithelial layers, and they inject it into the inside the blood. So this is called vector-borne penetration. So in a nutshell, if you look into the infection control or infection spread rather, and its control, then we should learn what are the different virulent factors, internal and external virulent factors, and how can we control these virulent factors in order to cut cut the transmission chain, or cut the spread of these infection, or cut the infection caused by these bacteria, especially which are antibiotic resistant bacteria. Now, why we are more focusing on antibiotic resistant bacteria in a hospital setting? Because in hospital setting we have a lot of infection, lot of load of these antibiotic resistance bacteria, where the bacteria persist in the hospital in different form. They may be in the environment, they may be on the different environmental setting like a cots, ventilators, intubators, right? So usually the patient which are on intubation are patients on for some time on some intubation period. Intubation period here means like maybe he or she is on the cot, she is on the on the ventilators, or for some time nebulizers, and some small kids, neonates, they are on the incubation system, or on the some special cots. So all these things which are present in the hospitals are infected. So this transmission chain could be cut in order to spread the infection, and these are all different types of penetration where we can block the penetration. So the take-home message is that in order to control infection, what is required is to block the adherence and block the penetration process of these pathogens, whether it is a bacteria, a virus, or some parasites. And once we have successfully done that, probably we can control the infection. Okay, thank you very much, and we have another lecture soon on the next topic. Thank you.